Good morning. Today is Saturday, October 3rd, 2020. This is our schedule, Saturday morning yoga therapy class through Sattvic Space Yoga and Healing Studio. Today's discussion and practice is going to be yoga therapy for truncal obesity. From medical standpoint, this is one of the most important practice for our integrative medicine. As you know, our class is primarily integrative medicine, is integration of yoga therapy, Ayurveda and Western medicine, and we call it a healthy convergence. That is the name of my book, and many of you have my book. Excuse me. My book and the DVD is widely circulated now. So before we start the practice, let's talk a little bit about truncal obesity, why it is so important from therapeutic perspective, and what we can do. First of all, what is a truncal obesity? Second, we'll talk about what is the basic physiology or basic mechanism of truncal obesity. Third, we'll discuss the practice for prevention and management of truncal obesity. Truncal obesity, as the name clearly says, trunk, body trunk. For prevention. This happens. So the truncal obesity means my trunk of my body, and is mostly in the abdominal area. So, what is the concern? You hear all the time that a generalized obesity, we call it overweight. We always say that is harmful for our health. Obesity today is almost regarded as your next to smoking. I have today another program just after this, and yeah, that's what it is. Just after this class, I have a session that I'm a panelist. The topic is role of yoga in the prevention and management of cardiovascular diseases. And I will be finishing this class a little early because the session starts at 10:30 our Eastern time until 12. So I will finish the class around 11, and I will go and then join for my next session. Truncal obesity. As we said, we know our whole general obesity is harmful for our health and healing. In fact, to this day, it is even compared to even the effect of smoking in our body and mind. Truncal obesity, on the other hand, it is just in your trunk. And trunk is, we call it what is called the abdominal area. From the lower part of your rib cage up to your pubic bone and the left side up to iliac crest. Whole abdominal cavity. First, let's talk about the cause of this truncal obesity. Then we'll tell you the markers of the truncal obesity. Then we'll tell you the practices for prevention and treatment of the truncal obesity. The general obesity, which is a accumulation of fat, collection of fat underneath my skin. It's called a subcutaneous tissue and all over my body. Truncal obesity, on the other hand, is the fat, collection of fat, which is called a visceral fat, which is also named called omental fat, which is inside my abdominal cavity. It is not under the skin. Because the abdominal wall has a skin, subcutaneous tissue, muscles, peritoneum, then you have the abdominal cavity. It's inside the abdominal cavity. The cause we find out is the high level of cortisol in our body. Cortisol is called a stress hormone. When you get stress, which is a fear of unknown, we get the activation of our limbic system. Limbic system sends a signal through neurotransmitter, through hypothalamus. Hypothalamus sends a signal to autonomic nervous system, to hypothalamus, pituitary adrenal cortex, and there is an increased level of cortisol. Cortisol converts our end product of metabolism, which is glucose to a omental fat, intra-abdominal fat, with a phenomena called thrifty gene hypothesis. Thrifty gene hypothesis means body feels there may not be any food, there may not be any calorie tomorrow, so body is trying to conserve the energy in the form of omental fat. Omental fat also have another cause. If we eat a carbohydrate, specially called refined carbohydrate. Refined carbohydrate means all the white carbohydrates, white flour, white sugar, white rice. When you eat a white refined carbohydrate, you get a sudden spike in the blood sugar. When you get a sudden spike in the blood sugar, body releases sudden spike of insulin to reduce that blood sugar. So normal body's homeostatic process. Insulin then reduces the blood sugar, but some of the insulin stays in the blood, which again acts like a cortisol, converts your glucose, which is not being used, to your omental fat. This omental fat inside my abdominal cavity acts like an endocrine organ. It secretes a substance called adiponectin and pro-inflammatory molecules. That means it causes inflammation. The pro-inflammatory molecules then creates a chronic inflammation and a sequence of diseases like diabetes, hypertension, coronary artery disease, atherosclerosis, blockage of the blood vessels, and we call it a dyslipidemia. Dyslipidemia means sometimes it is a high cholesterol, or other time cholesterol may be in a normal range, but it is a low HDL. HDL is called a high density lipoprotein, which is a good cholesterol, low HDL, and a high triglyceride. So the whole combination, the name is called today metabolic syndrome. So metabolic syndrome means it starts with the truncal obesity, diabetes, hypertension, coronary artery disease, increase in your cholesterol, or called high cholesterol, or increase in the triglyceride and a low HDL. And these are all called lifestyle-related disorders, and the combination of all these diseases are killing us today. So the concept here is, when you get the truncal obesity today, tomorrow you will get the diabetes. If you get the diabetes tomorrow, day after tomorrow you will get a heart disease. If you get a heart disease, you'll have hypertension. It basically, what chicken come first or the egg come first. There is no more risk factor. We used to call this as a risk factor of our heart disease, risk factor of our diabetes, risk factor of hypertension. Today we know this is a single syndrome called metabolic syndrome. And that's the reason truncal obesity is so harmful for our health and healing. What are the markers of truncal obesity? What do I look for? First, we all talk about a body shape, apple shape or a pear shape. You always hear about it. Pear-shaped body, when you look at a body like a pear shape, it's okay. Pear-shaped body is not that harmful for our health and healing. But the apple-shaped body, they're expanding waistline. We call it spare tire. We have a lot of nicknames for this. It is very harmful for our body and mind. First, when you look at obesity, obesity is measured by a term called BMI, called body mass index. BMI is measured by body weight in kilogram divided by my height in meter times square. So if my body weight is about 65 kilogram or 70 kilogram, and my height is 1.6, 1.5 meter, that is square of that. 1.5 times 1.5 will be 3. So say 65 by 3, little over 22 will be my body mass index. Normal body mass index is between 18 to 25. Less than 18 is unhealthy, above 25 is also unhealthy. Above 30, we call it obesity, and above 35, we call it a morbid obesity. Morbid obesity has a lot of definition. Generally, we call it about 100 pounds over your normal body weight. What is your normal body weight? Normal body weight, generally a rule of thumb, is you should have between your height and the body weight. Height about 5 feet is considered about 100 pounds of your body weight. Above 5 feet, each inch, 1 inch, increases 5 pounds of your body weight. So I'm 5'8". So my body weight will be 100 plus 5 times 8 is a 40, 140 pounds with 10% deviation. 10% less, 10% more. So my body weight between, if I go 10% higher, is 154 pounds is the max. And if you come lower, would be 126 pounds is the lowest. If I go less than 126 pounds, I'm still unhealthy. If I go above 154 pounds, I'm still unhealthy. For the truncal obesity, it is totally in the trunk. It has nothing to do with the body mass index, BMI. The first measurement of your waist. Measurement of your waist is done between the last rib. And if you feel a bone here called iliac crest, between the first rib and the iliac crest, if you come in the middle and the measure, this is your circumference of your waist. Generally, it is little lower than your umbilicus. It's not generally above, below the umbilicus. And this circumference is related to your body height. In Western medicine, the truncal obesity is described as a woman above 35 inch of the waistline, and for the men above 40 inch of the waistline. But what we find out that we have a lot of so-called skinny people. That is skinny arm, skinny leg, but they have a huge, big truncal obesity. So we don't consider those numbers because for them 35 inch or 40 inch will be huge, big truncal obesity. So we measure the truncal obesity. The first term is called the height and the waist ratio. Whatever is your height in inch, waist should be less than half of your height. What does it mean? My height is 5 feet 8 inches. The 5 feet is 5 times 60 plus 8 is 68 inches. 68 inches is my height. My waist should be less than 34 inch, half of my body height. Clear? Half of your body height in inch. Less than that is normal, above that is a truncal obesity. Next is the waist-hip ratio. Remember pear shape and the apple shape? So you measure your waist, whatever is the circumference of your waist, then measure your hip. So waist-hip ratio means you put the waist on the top, hip in the bottom. For the men, if it is more than 0.9, it is a truncal obesity. For women, it is more than 0.85. It's a truncal obesity. Because the women generally has a little wider pelvis, so the number is a little lower. So these are the numbers and figures, and most important concept, what you need to hear today from me, is that truncal obesity is resistant to diet and exercise. You keep on exercising, keep on dieting. You know that food is not a calorie. Food needs to be digested. Food needs your parasympathetic activation. Parasympathetic activation is called calm and digest. So, a therapy for the truncal obesity. From yogic perspective, yoga says if you massage an organ, the organ function gets better. So if you massage the local abdominal omental fat, that should be your part of therapy. Mundukasana, very much massaging the abdominal omental fat, and the massaging the internal organs. For example, Kapalbhati pranayama, Uddiyani bandh, abdominal lock, breathing out, take a deep breath in, breathe out, suck your stomach in and hold. Uddiyani bandh, abdominal lock. Then Agnisar Kriya. Agnisar Kriya is the abdominal wall, massaging the abdominal wall with the Agnisar Kriya. Also, all these practices are relaxation response, activation of parasympathetic tone. Very, very important. Asana-wise, activation of relaxation response is you're able to sit in a Vajrasana, thunderbolt. Vajrasana is most relaxing and activation of parasympathetic tone. Shashanka Asana, like a rabbit pose. So thunderbolt, Vajrasana, followed by frog pose, Mundukasana, then your Shashanka Asana. Absolute therapy for your truncal obesity. From yogic and Ayurvedic perspective, it is also due to your low Agni, Jathar Agni, the digestive fire. You ignite your Jathar Agni, same way, Kapalbhati pranayama. Kapalbhati pranayama is your metabolic pranayam. It ignites your Agni. Agni is a digestive fire. Abdominal lock, Agnisar Kriya. Then you do the asanas which are centered in your umbilicus, belly button. Asanas are your laying in the yoga mat, raise your feet up, fit raising pose, Utthita, Padasana. Utthit means raise, Pada means fit. Boat pose, Nokasana. Knee chest, Pavan Muktasana. Markatasana or spinal twist, we call Jathar Parivartanasana. Jathar means your abdomen, Parivartan revolving, stomach revolving pose. So think of that as massaging. Bridge pose, Satubandha Asana. Then touching your feet to your nose or your forehead, Padamastika Asana. Very, very important concept. So before we start, let me tell you another very interesting concept. Like we have all these parameters. So remember, the absolute, the BMI, body mass index, is for global or general obesity. Less than 18 is abnormal. 18 to 25 is normal, above 25 is overweight, above 30 is obesity, above 35 is a morbid obesity. Morbid obesity basically means it is a disease, it's a comorbidity, comorbid condition. Absolute number of the trunk of your waist, men above 40 inch, women above 35 inch. But most important ratio, the height and waist ratio. Height in inch, waist should be less than half of your height in inch. Waist hip ratio, measurement of your waist and measurement of your hip, above 0.9 in men is truncal obesity, above 0.85 in women is truncal obesity. For yogis, it's called yogic BMI. Yogic BMI, you measure your wrist. You hold on to your wrist and see where you are. This is your size of your wrist. You have a separation of this much. Take the same hand about the middle of your arm, put your hand, and the separation between these two fingers will be same as the separation in your wrist. Look at this. This is the separation in my wrist, and this is the separation in my middle arm. This is yogic BMI. Yogic BMI is the middle of your thigh from your knee up to the iliac crest. From here to the iliac crest, if you come to the middle, if you put your hand, you will be able to put your hand touching your middle finger and thumb. Your middle of the thigh should be within this. That is yogic BMI. Finally, it's a wonderful way of measuring. You put your hand on the both sides, slowly bring your middle finger, and both of them will touch at a level of your belly button. Look at this. My thumb is on the side. I'm bringing my middle finger, touching my middle finger at the umbilicus. This is my yogic BMI. Wrist, arm, thigh, and waist. Can't miss it. So let's do a little practice today. We have a lot of questions, and if you have any comments, questions, please ask. And as I said, I cannot read and do the practice. I will go ahead and answer it. First, able to sit down in a thunderbolt, Vajrasana, especially after a big meal. After lunch or after dinner, we like you to sit down in thunderbolt, Vajrasana. Vajrasana, I hear so much complaint from the people. I cannot sit down in Vajrasana, what should I do? In stages, impossible become possible. So, let's take what you have in your hand. What will be the first problem in a Vajrasana? First problem is your ankle. See, what you need to do, you need to start, let's see, if we can see it here, if you need to start, even put your ankle like this and see if you can sit in an ankle first. Then if you are able to sit down on this posture, then keep your eyes closed, keep your spine straight, keep your hand in a Adhi Mudra. This is called most relaxing mudra. We call it a Bala Mushti Mudra. That is the way baby closes the hand. Close your eyes and do your breathing out longer than breathing in. There should be no pain and your breathing should be effortless. I hear it so many times. My knee is hurting, this thing. It's fine, you'll be able to do this. Next, if you go and able to sit down on your ankle like this, then you might start having some pain, especially when you keep your spine straight. In that situation, you can take a small, generally something rolled, if you can do rolled, and put it underneath your ankle. Put it underneath your ankle and sit down. You will feel a profound level of relaxation. I generally like to put a folded blanket. So in a folded blanket, we'll be able to remove it one layer at a time. And people ask me how long, what is it? For your truncal obesity, for your proper digestion of your food after a big meal, you sit down as long your body will allow. What are the markers? Pain. If you develop any pain, you slowly back off. At the beginning, you do as much as you can. And your breath, because body to your breath. Any imbalance you create in the physical body shows up in your breath. So I'm sitting here, I'm talking, I just want to show you that's the way you stay after a big meal. And this is the only asana, only pose. There may be a few other, but it's the only one we recommend that you will be able to do with a full stomach. Rest of the yoga practice you do with your empty stomach. Next, I hear all the time, I cannot sit down. I still have a problem. Yes, I have a problem. I have a problem with my knees, I have a problem with my ankles, but with slow, gradual practice, everything goes away because body develops a phenomena called neuroplasticity. If you cannot sit down in this posture, take a little bit, another small pill. This is very nice. And you will see, you will be able to remove it one step at a time. This is under my ankle and this will be under my hip. Wow. It's a profound level of relaxation. And if you can sit down here for a little longer time, that is the first practice for your truncal obesity. Excuse me. I'm having they're trying to reach me for my next session. Let me just take a look at it, if you don't mind. Okay, thank you. They're asking. So we said when you do the yoga practice, there will be no disruption. But in this COVID-19, we are doing programs after programs from home and one after another. So now you'll be able to sit down in a thunderbolt or vajrasana and slowly, see, I got rid of all this, but you will be able to get rid of this too. But you feel there's no pain, and your breathing should be effortless. And effortless breathing is you can talk, you can even sing. Next one practice would be your Mundukasana, frog pose. Sitting down. If you're practicing with me, see if you can do with me. Able to sit down in a Vajrasana. Put your left hand over your belly button, right hand over your belly button. Generally, you try to suck your stomach in a little bit, and the best way to do is breathing out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold a little bit. And slowly keep coming down and listen to your body's signal. What is your body's signal? Your body's signal will be no pain and a effortless breathing. So to be sure you see. You keep coming down wherever you find the place for your no pain, effortless breathing. Even in this posture, if you're here, stay here, close your eyes, do the breathing out longer than breathing in. Like count of 2 in, count of 4 out, at least 5 to 10 breaths. If you can come down all the way, come all the way down, put your head down. And slowly come back home. In a regular practice, stay in the pose for a little longer and longer. Always practice, remember, with a smile in your face and with the effortless breathing. You also do with a Adhimudra, because Adhimudra is relaxing. Put your thumb inside and close, and put both the hands together at the level of your belly button. Same practice and with the effortless breathing. Remember, if you create any imbalance in your physical body, it will show up in your breath. And it is a non-competitive practice. You are not competing with anybody. You are only competing against yourself. Today, if you can come down even here, but stay here. How long? As long as your body will allow. If you can do about 5 to 10 breaths, it's good. If you can come down, slowly can come down, you come down here, stay here. Talking, breathing. I'm showing you coming all the way down, but generally also I stay here for a little longer time. Remember, our experience, our practice, our research showed that this truncal obesity is resistant. I'm emphasizing resistant to your dieting and or exercise. but it is treatable with your yoga practice. I have seen a lot of people, and many of us, we have seen a lot of people testimonial just able to sit down in a chair and doing just Kapalbhati pranayama very effortlessly reduces their truncal obesity. Quieting down your mind is very important because the root cause is the cortisol, root cause is the stress, the fear of unknown. Rabbit pose, rabbit is all running around and rabbit is quieting down. So rabbit pose, take your hand, called Shashankasana. Shashankasana, you go all the way out, slowly put your elbow in the ground, bring your head down, touch your head to the ground, and you stay here. When you get up, slowly get up, the hands are folded. You will do asanas, laying down, asanas, centering in your belly button, and it is also called belly button centering. If your umbilicus is centered, your truncal obesity slowly goes down. For male, it is very easy. You take a little thread from umbilicus, you go to the nipple line, and both sides should be equal. And men, you go ahead and measure it, and most of the time you'll find it is not equal. For the women, we recommend from the belly button to go up to the end of the collarbone and both sides, or from the belly button, somebody else can measure up to the tip of your big toe. You also, when you're laying down, you can put your finger in at the level of umbilicus. You'll be able to feel a pulsation called aortic pulsation that tells you your umbilicus is the center. We'll do show you the asanas laying down for your belly button. Remember you're massaging this part. Very important yogic concept. So, and you will finish with what is called the abdominal breathing. When you do the abdominal breathing, it is like a baby. Baby is breathing. Abdominal breathing, abdominal will go up with the inhalation, go down with exhalation. Abdominal breathing is a very relaxation response. It is the activation of parasympathetic tone and able to reduce the truncal obesity. So, able to sit down in this thunderbolt, Vajrasana. Longer and longer you can sit down, better and better your practice is going to be. Oh, I hurt my knee, I injured my meniscus, I have my ligaments. Yeah, look at mine. My right knee is more swollen than my left knee. But I had it checked. This is called little old meniscal tear, your suprapatellar bursitis. It is all part of our living longer, without called aging process. Also, when you have the truncal obesity, if you cannot sit down like this, you can sit in a chair. Let's show you a little pranayama sitting in a chair. How to sit down in a chair. Few people ask me how to get up from laying down or sitting up in a yogic way. In yogic way, what you do, if you are laying down doing asanas, you slowly roll onto your one side. We generally prefer on the left side. Then you put your one hand, straighten up your leg, put your body in a fetal position. I'll show it to you. I'll show it to you. And then if you're able to sit down, this is called your squatting pose. Squatting pose is very important. Squatting pose and keeping the body straight. This is called a malasana to your body straight, called dandasana. Vajrasana, the thunderbolt, malasana, and then you're keeping your body straight, spine straight. And we do it all the time. I've shown it to you. I do it against the wall. So able to sit down if you're able to get up without a support. Very important yogic concept. So, when you're standing up, you'll always remember, you stand up with put your feet together, your ear, your shoulder, your hip, and the ankle in the straight line. This, you will be surprised to see, this is a therapy for your truncal obesity. And there is a tremendous explanation for it. You can do it anywhere. You can put your body against a wall and you can do it. If you find any wall, you find a wall here, I have shown it to you, put your body against a wall, again touch your back of your head, your shoulder, your hip and the ankle, put your hands high up. Keep your spine straight. Sit down. Sit down in a chair, all the way to the back. Keep your spine straight. For truncal obesity, most important practice is your Kapalbhati pranayama, breath of fire. Do Kapalbhati pranayama for truncal obesity with the two mudras. I have shown it to you all the mudras. If you can remember which is which, we have 5 elements: space, air, fire, water, earth. Space is the middle finger, air is the index finger, fire is your thumb, water is your little finger, earth is your ring finger. Touch your ring finger and the thumb, Prithvi mudra. This is for your truncal obesity. Then touch your middle finger, ring finger and thumb. It is called Apana mudra, called Pachan mudra, digestion mudra. Kapalbhati pranayama, you have a balloon here, you have a diaphragm here, another balloon here. Bring your awareness in your belly button. Push your belly button. Every stroke, 1 per second. And completely effortlessly. Remember, I told you, this same Kapalbhati pranayama When you are doing it for a long time, especially when you are pretty young, you will be doing it very rapidly, but without any effort. That means your breathing is still normal, very rapidly. That becomes, we call it kriya. It's called a shat kriya. Shat kriya, shat is actually is a Sanskrit for 6. There are 6, we call it actions or kriyas to clean your physical body. So let's start the practice. You start with your touching your ring finger and thumb, putting it gently over your both the knees. Initially you will see when your mudras, your finger curls like this. Don't try to straighten up. It will straighten up when the relaxation response will set in. When body is tight, your fingers will be tight. Your fingers will be like this. Slowly and slowly the fingers will drop down without knowing. Close your eyes. Keep your spine straight. Bring your awareness to your belly button and push the belly button back 1 per second. So all my awareness is my belly button. I'm not even breathing. It is an active exhalation with a passive inhalation without knowing. I am not breathing in. I have no connection with my breath. My mind is only in the belly button. It's massaging my visceral fat, abdominal fat. Let's keep doing it. We generally do it with all the mudras. These are called your dhyana mudra, jnana mudra. They call it vayu mudra. This is your shinda mudra. This is your prithvi mudra, mudra of your earth. This is your varun mudra, of your water. This is called your prana mudra, shakti mudra, strength. This is called apana mudra, digestion mudra. If you put index finger down, this is for apana vayu mudra, that is for your heart. You have a lot of mudras. So let's try this. Let's practice about 50 Kapalbhati pranayama, very gently. Maybe do 25 on this and 25 on, call it Pachun mudra or Apna mudra, ring finger, middle finger and thumb. You guys will continue and I'll tell you the benefit and how it works for your truncal obesity. Spine straight, eyes closed, touch your ring finger and thumb. You keep on doing it. Let me tell you one. A lot of people have asked me how to start, they have a problem in starting. You keep doing it, don't stop, you keep doing it, I'm telling you, so that you can hear. They said, I cannot do what you are doing. I cannot push my stomach in. And if you put your one hand in your belly button, other hand under your nose, when you push your belly button in, you'll see the air comes out. Then you know you are massaging your abdominal contents. If you cannot start, see first if you can start to do a simple coughing. So you can cough. See, in a cough, you're pushing your belly button in. After a while, when you are able to do the coughing, Now you see you can do the coughing with your mouth closed. Your mouth is closed, try to do a coughing. That will convert into your Kapal Bhati Pranayama. Kapal is the forehead, Bhati is the shining. It ignites your digestive fire called Agni. It increases called Tejas. Tejas is the fire within our body. Tejas. Keep doing it. Let me tell you the benefits. Since you are doing it for a while, let's touch your middle finger, ring finger and thumb and continue the Kapalbhati Pranayama. I did a session yesterday and that was actually in a different language called Bengali. I showed how to prepare your body and mind before starting a therapeutic pranayama practice. But if you can keep your spine straight, eyes closed, and continue this Kapalbhati Pranayama as long as you don't have any effort in breathing. Initially it could be 30 seconds, it could be 1 minute. Generally in a daily practice, we like to do it between 5 to 10 minutes. In a Truncal Obesity, we like to see when you do 15 minutes of this Kapalbhati Pranayama. For us, sometimes we do Kapalbhati Pranayama in our empty stomach almost throughout the whole day. It really energizes you. It increases your Agni. If you in the office, you're feeling little lethargy, drowsy. Massages all the intra-abdominal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your small intestine, massages your large intestine. For women, massages your uterus, massages your ovaries, massages your tubes. For men, it massages your prostate, massages all the visceral fat, all the fat inside your abdomen. Even the yoga therapy is not a reductionist practice, it's a holistic practice. We call it a reductionist holism. In holistic practice, we also have some reductionist. And that reductionist, if you ask, the one practice for truncal obesity is your Kapalbhati Pranayama with your spine straight, eyes closed, and touching your ring finger and thumb, middle finger, ring finger and thumb. Uddiyana sitting in a chair, same concept. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. You do it as many times as you can, because your breath has to be effortless. When you're doing it for a while, generally said you can do it between 5 to 10 daily. And then when you do this abdominal lock, you also incorporate chin lock and also the root lock, which is called a great lock. When you do a great lock, slowly drop your chin down, touching your chin to the chest without bending your neck, and then contract your pelvic floor and the anal sphincter and pull it up. Let's do it one more time. My hands again in like a Adhi Mudra, relaxing mudra over my knees. Breathe out first. Deep breath in. Completely breathe out. Abdominal lock, chin lock, root lock. Agnisar Kriya, massaging your omental fat. Remember the basic yogic principle. Massage your organ of healing, the organ you need to heal. Adhi Mudra, spine straight, eyes closed. Breathe out first. Take a deep breath in. Completely breathe out, suck your stomach in and move. Abdominal wall is relaxed enough. It moves back and forth and massages your abdominal content, including the omental fat. One more time. Breathe out first. Take a deep breath in. Do it about 7 to 10 times daily. It should be a wonderful practice. So got it? Very simple. Vajrasana with a full stomach or an empty stomach. Frog pose, Mundukasana in empty stomach. rabbit pose, Shashankasana in empty stomach, Kapalbhati Pranayama with a mudra of the earth, Prithvi mudra, or Apana mudra, Panchan mudra, digestion mudra, ring finger, middle finger and thumb, breath of fire, Kapalbhati Pranayama, abdominal lock, Uddiyana Bandh, and moving your abdominal wall, Agni Kriya. Let's see if we could do a little laying down, and we'll finish your practice in laying down. When you want to lay down, be sure you lay down slowly. You lay down and be sure your head, if it is not supported, that your chin is not, head is not high up like this. This is very called sympathetic. You want to be your head. So if you feel you're uncomfortable here, just use a small pillow. Use a small pillow like this. So you can do also with the pillow. Keep your feet together. Hands both sides, palm facing high up. Raise your both the feet high up. This is called feet raising, Padottanasana, about 30 degrees. Stay here as long as you can without any pain or effortless breathing. See, if you feel your stomach here, it is tightening it up. It's massaging your abdominal content. From here, you can get into your Naukasana, boat pose. And if you do the boat pose, you'll see this is massaging here, boat pose. And for the sake of time, I'm showing you the poses, but you stay in the pose a little longer, 5 to 10 breaths. This also ignites your digestive fire. It also helps belly button centering your belly button. Third asana, Pavanuttanasana. Both the knees, put your hands together, bring your nose touching your knees, chin goes in front of your knees. If you relax enough, you can roll side to side. You also can roll front and back. I'm showing you the asanas which you need to practice for your truncal obesity. Every time you do asana like this, you can feel your breathing is getting a lot slower and slower and a lot deeper and deeper. You'll be able to see your stomach is also sinking in. Spinal twist, bend your knees, hands on both sides. Look into your left hand and drop both the knees to the right side. most important practice is able to stay here. Able to stay here as long as you can, between 5 to 10 breaths. This is also called abdominal rotation pose, Jathar Parivartanasana. Same way, you do it at the opposite side. Completely go down and look into your right hand. Slowly come back. If you want to practice, extend the practice a little bit more. You can raise both the feet high up. Look into your left hand and drop both the feet on this side, touching your right hand, and look into your left hand. Come back again, the same way, go to the opposite side, touching your left hand and look into your right hand. You're noticing that it all massaging your abdomen, where the truncal obesity lies. You will feel your rib cage, you'll be able to feel. You'll feel your stomach wall is diving in. Setu Bandhasana, bridge pose. Separate your feet up to the width of the shoulder. Touch the back of your feet with a hand and slowly raise your body higher. Remember, you are doing it very gently, effortlessly. You can keep on going all the way high up, but that is not how high you go. It is how long you can stay in this posture. Here, you will go high up. You will keep on going high up, but then you will come down. That is not going to help you. But if you stay here a little longer, that will give you more help than trying to do all the way high up and not able to stay. So you are staying here, and then you can see the stomach wall is very tight. That's the therapy you need. Put your 1 foot high up. Balance it, put other foot high up. The body is still high up in a bridge pose and slowly come down, one step at a time. All we're doing is massaging our abdominal content. Pada Mastikasana, touching your feet to your forehead or touching your great toe to your nose. Sanskrit name will be Pado Anguli, means toes of your feet, Nasha Sporsha, touching your nose. So bring your feet here, slowly bring it up, touching it to your forehead, touching the tip of your nose, and able to stay. That ignites your Agni. Bring the other foot high up. Bring it up slowly, close to you. Touch it to your forehead. Touch it to the tip of your nostril. Keep the other leg straight. Then when you get relaxed, what you can do is a very nice way of checking the effect of it. You feel your belly button, put your hand in the belly button and slowly push it down. See if you can feel the pulsation. It is called the aortic pulsation. If you can feel the pulsation, your belly button is centered. There's a lot of technique we have. We have we touch a great toe, you can kick it out. There's a lot of way hands you can put together and see the lines, but we'll show it to you another time. Belly button centering. Let's finish with the abdominal breathing. What is abdominal breathing? Abdominal breathing is the breathing of the babies. If you look at a baby, then if you look at a baby, look at how the baby will sleep. Baby will sleep. It's called your Supta Baddha Konasana. You put your feet together, knees goes down, and if you can sleep like this, you get a profound relaxation, and this is essentially a therapy for truncal obesity. Our study showed people who does not have enough sleep, people with a sleep apnea, people with insomnia, the first effect they get is your truncal obesity. Root cause of truncal obesity, remember the stress. Stress comes primarily from a fear of unknown. Stress comes primarily from sleep apnea and insomnia. One hand in your abdomen, breathing out first. When you breathe in, your abdominal wall will go high up. Go down, abdominal wall comes down. Breathe in. Breathe out. Breathe in. Breathe out. Do it about 10 times. Many a time, if you have feel uncomfortable, what you can do, you can take a pillow and put it on one side. Looks very nice. And put another pillow on the other side. And we're doing abdominal breathing. a wonderful practice for your truncal obesity. Another one, to tighten up your abdominal wall. So take a look at it. You hold on to bend your knees, hold on to that, and slowly try to raise your head high up and try to ground your feet on the ground. Put your feet on the ground and you stay in this posture, hands below the knee, head high up, close your eyes and breathe in and out and see how much tightness you put in your abdominal wall. Your abdomen has been massaged. See, the same asanas which you practice for our daily practice, we have picked and choose for our truncal obesity today. Then another way to sleep on your left side and sleep like a baby. For the baby in your mother's womb is called a fetal position. Fetal position, put your both the hands, support your head, this is on the right side. On the right side you start your initial sleep, and on the left side you sleep for a longer time. And when you get up, you straighten up your one leg, put your hand and slowly get up and sit down in your cross-legged position, Sukhasana, Siddhasana, Padmasana. It's a wonderful practice, you do it. Let's go over with the summary, what you call a gist of the practice we've done today. Truncal obesity is the worst clinical condition we can have today. Any lifestyle related disorder you see is due to truncal obesity. Measurement of the truncal obesity at the level of your waist. The absolute number is women over 35 inch, men over 40 inch. But that number doesn't correlate with the people who have a skinny arm, skinny leg, and a big truncal obesity. Measurement at the level of your waistline, less than half of your height in inch. 5 feet 8, 68 inch, waist should be less than 34 inch. Waist-hip ratio, measurement of the waist at the level just below your belly button and the waist, more than 0.9 in men is a truncal obesity, more than 0.85 in women is a truncal obesity. It is due to your stress, high cortisol, and also from the refined carbohydrate, white sugar, white flour, white rice. First treatment is no white in your food. It's due to your high level of insulin, which converts again your extra sugar into omental fat. This fat is inside your abdomen, it is not under your skin, and is resistant to diet and exercise. Most important yogic practices, your thunderbolt Vajrasana in a full stomach or empty stomach, then massaging your abdominal content with called your frog pose or Mandukasana, and you're relaxing your body and mind with your rabbit pose or Shashankasana. Kapalbhati Pranayama, the breath of fire, with mudras called your Prithvi Mudra, touching your ring finger and thumb, and middle finger, ring finger and thumb. This is called your Apana Mudra or Pacha Mudra. Abdominal lock, breathing out first, Breathing in, breathe out, sucking your stomach and hold it, along with a chin lock and a root lock or a great lock. Moving your abdominal wall up and down, back and forth, called Agni Kriya, to massage your abdominal content. Laying down, massaging your abdominal content, feet raising, Padavuttanasana, boat pose, Lokasana, knee chest, Pavanmuktasana, massaging your abdominal content, Markadasana, monkey pose, or called Jathar Parivartanasana, abdominal rotational pose. Bridge pose, Setubandhasana, feet touching your forehead, Padamastikasana, followed by sleeping like a baby, called Supta Baddha Konasana. Supta means laying, touching your feet together, let the knees on both sides, and doing abdominal breathing. When breathe in, abdominal wall go high up, breathe out, abdominal wall will go in. Thank you for your participation. Today I have another session I'm going to join now, so I'm going to finish a little early. Next Saturday I will be out of town, but I plan to have a class from out of town, from another setup, probably my daughter's house. But next Friday, during my class time, I'll be traveling. So next Friday there will be no class, which is in Bengali. But next Saturday we'll have a class. Probably on the same context will be a class on yoga therapy as a relaxation response. We want you to have a practice of the relaxation response. You feel the effect of it in your body and mind. Then you will see how it affects the different clinical condition which we are going to treat. Chronic pain, your cancer, your lifestyle-related disorder, all will get better and better when you feel the effect of relaxation response and activation of parasympathetic tone. Thank you for your participation. We'll see you again on next Saturday.